Good afternoon. Welcome to Midday Update with Thai PBS World and with me, Kiratikon, Tulip, Naksompop, Blauw. And today we will give you an update. First, we will start off with the latest number of the infection. Let me show you today that we recorded 205. Today we recorded 205 infection. There, that's the number. And let me see. So you get something moving as well. And I'm trying to make it included everything as much as possible. So here is the number today, no fatality, and record 205 new COVID-19 cases. 131 of those are locally transmitted cases. There is another 58 being discovered through proactive screening, and the rest of the number among those entering the country legally and in state quarantine. So there are 734 new recoveries and no fatalities were recorded today. That's a good news. There are still 4,519 patients receiving treatment. The government says that the use of tracing application yesterday has become a big question, whether they're going to get legal charged or anything if they don't have this application with themselves. So Dr. Thavisin Visanuyotin, which is the spokesperson of CCSA, said that the use of tracing application is necessary to protect Thailand. If anyone becomes infected, conceals their movements, and has not been using the tracing application, it will be very difficult to trace their contacts and they will face legal action. So if you're not trying to conceal your information, even though you don't have this application on your mobile phone, or if your mobile phone is not really, it's not a smartphone, let's say that, you probably will not be charged if you're not trying to conceal any of your movement information. So there are now infections in 57 provinces. Buriram is the latest to find an infection which is related to a cluster in Pattaya. Samut Sakhon has the largest cluster, we know that already, mostly discovered through proactive screening. The province total infections since mid-December has now reached over 3,100, to be specific, 3,142 cases, followed by Chonburi at 475, Rayong at 427, and Bangkok at 364. There are 20 provinces that are still free of COVID-19. I'm just going to tell you these 20 provinces: ศรีสะเกษ ยโสธร บึงกาฬ หนองบัวลำพู ร้อยเอ็ด กาฬสินธุ์ นครพนม มุกดาหาร แพร่ พะเยา เชียงราย แม่ฮ่องสอน อุทัยธานี พิษณุโลก พังงา พัทลุง ปัตตานี and Yala. And there are 4 provinces which have not recorded any new infections in the last 14 days. They are Phetchabun, Kamphaeng Phet, Udon Thani, and Phuket. And Dr. Thavisin said that they are doing pretty good because it has been 14 days and they still not have any new infection. And these provinces have been doing pretty progressive or proactive screening. Now, talking about the field hospital, let me show you some video today. This is an interesting video because this is the video of one of the doctor in Samut Sakhon that took Thai PBS reporter on a tour in the 3rd field hospital of the province that will begin its operation later today. That is Dr. Porntep Pongthavikon, the director of Ban Phao Hospital. I'm talking about field hospital because there's a lot of provinces that they don't want field hospital to be set up because they're afraid that it might spread the germs, or they just feel scared because they're not sure what's happening. But today, the medical expert To be specific, Dr. Prasit Wattanapa, which is the Dean of the Faculty of Medicine at Sirius Hospital, said that field hospitals are necessary, especially in areas experiencing increasing numbers of COVID-19 infections. These temporary facilities are intended for asymptomatic and mild symptom patients, separating them from the general public. So if we know where they are, treat them correctly, it should be able to help contain the outbreak. Dr. Prasid said that if we do not start setting up field hospitals now, the outbreak in Thailand will get worse. And he said field hospitals are one of the tools for containing the outbreak and enable the effective management of limited resources. Dr. Prasid said that this wave of infections appears to stem from illegal activities such as gambling dens and migrant trafficking, making contact tracing a challenge. Many people do not tell the truth about their whereabouts and attempt to conceal their movements. So many have still not been isolated. So he believes that ultimately the number of cases will exceed the number of hospital beds available, with many hospitals in high-risk areas already sending the signal. So field hospital is a very good tool. It's a very good, cannot say option. It's something that necessary, Dr. Prasid said, to make sure that our resources is not stretching so thin, to make sure that our hospital, the main hospital, will only facilitate the one with the severe symptom and also other kind of patients only. So the one with no symptom, which is a symptomatic symptom or mild symptom, can just stay together in the field hospital. Now, that one, I forget this. Okay. The next one is Loei province. Loei province has ordered the closure of the schools and lottery market after they're finding more COVID-19 cases. Loei province said that these facilities have to be closed for 14 days because they found that the whole family, one of the family member is a lottery vendor, is affected. One case in the province is a 78-year-old woman and a mother of another case in Loei. Another is a related 13-year-old 7th grader who usually went with his mother, who also, here's the thing, these whole cases, it's the same family. Today, there are 3 new cases. And these 3 new cases related to the previous 3 cases that discovered days ago. There was this one woman, which is a lottery vendor, that was discovered earlier. And 3 cases today is the mother of the woman, a son, a 13-year-old son, 7th grader, and a 6-year-old kindergartner daughter. These 2 kids, the son and the daughter, always tag along with the mother to sell lottery. And that is probably increase the risk of them getting infected so that they finally get infected. And the mother of this lottery vendors, which is a 78-year-old woman, also tested positive now. The province stated that there are a total of 35 high-risk people waiting for test results. These new infections were discovered as a result of proactive screening of over 1,200 people, especially among lottery vendors in the province. So, like Dr. Tavisin said, a lot of provinces now have been doing a really good job of the proactive screening. So, we're just gonna have to support them and try to keep ourselves safe with right now 4 measures. Used to be 3, used to be washing hands, wearing masks, keep distancing. Now, another thing that the government is asking us to do is to use tracing application, which at the end of this live, I would go over MorChana with you. Not that I'm an expert, I just downloaded today to see how it is, because usually we go with Thaichana and we just scan what's at the venue or at the facilities and we just check in, check out. But MorChana is something a little different. We'll go to that later. So now, something maybe feel a little close to home for a lot of people in Bangkok. The BTS announced that their employee, one of their employees, tested positive for COVID-19. Let me show you their announcement. The announcement. Here it is. There is the announcement. So BTS, the operator of Bangkok SkyTrain, reports one of its employees has tested positive. The employee worked at the headquarters building until January 5th, and his job does not involve train services. So, in another word, they say that he doesn't have any contact with the passengers. Everyone who has been in contact with the affected employee are being tested and quarantined for 14 days. The workstation of the infected employee is on the second floor of the building, which has been cleaned and disinfected, including the communal area of the building. So, and this is the timeline. He has been having lunch with his colleagues and his friends at Tam Nua restaurant in La San Street. And he come to work. He took New Year days off. He said he didn't go anywhere. So he lived in a 5-story condo building in Bang Nai area. He wear masks all the time when he was outside, and he didn't dine out. He got food delivered from his mother. And he came back to work on January 4th with his private car. And then he heard that the owner of Memory Pub in Sukhumvit 105 in Bang Na tested positive for COVID-19, which is the same owner of Tam Nua restaurant, which is a restaurant he had lunch with his friends 6 days earlier. So he asked his boss to just take the rest of the day off. He left the office at 4 p.m. and he just went to the doctor next day, and then he tested positive for COVID-19 at Sikrin Hospital. So that is his timeline. He got his result yesterday at 3 p.m. So the headquarters of BTS was closed to clean immediately. They said that everyone that in high risk group are all getting tested, waiting result, and in 14 days isolation. And another interesting news, I think this become news this morning because it's on the TV channel. Let me show you. This is the Facebook, this is the YouTube channel of their TV show. You see, it look different than if you see their show before. This look different than usual because this is their flagship news program in the morning on Channel 3 TV, and it was produced from the parking lot this morning, not from its usual studio, because one of the TV station's employee tested positive for COVID-19. The employee was working in the graphic department and has been in close contact with many other employees on the 5th floor and the 6th floor of the studio building. All employees working on those floors will be tested, while others in the building are considered at low risk but will be under close observation. Building disinfection began at 10 p.m. last night, and it was during this process that the morning news show airs. So they need to temporarily relocate their show to the car park. So I say this is just a new normal, I guess. The new normal of the TV show. There you go. Okay, now let's go to the Prime Minister. The Prime Minister, he has a podcast. It used to be a TV show, but now he doing podcast. Here it is. Okay. Let me show you what it looked like. There it is. That is the Facebook page, Thai Khu Pha, which is the government organization. It's the communication channel from Thai government. And yesterday afternoon, they posted a latest episode of the podcast by the Prime Minister. Wait, why did I do that? There it is. Sorry. So in the latest episode of Meet the People podcast, posted on the Facebook page, Prime Minister Prayut Chan-o-cha said that he is surprised that he is being implicated in benefiting from illegal gambling activities as he declared his determination to crack down decisively on illegal activity. The illegal gambling blamed for a cluster of COVID-19 infections. The Prime Minister said that officials do not want the virus to spread further, but he claimed there are some bad officials and people offer bribes to those bad officials, resulting in the virus outbreak related to such activities. He said that illegal gambling, illegal logging, the illegal drug trade and trafficking has been going on in Thailand for a long time. And to get rid of the problem, the government must find appropriate solutions based on legal principles. Yes. The Prime Minister said that he despises people who offer bribes to officials, so they will turn a blind eye to their illegal gambling dens and warned them not to claim that they are his relatives or his friends. Prayut insisted that he has never received any ill-gotten gains from illegal gambling dens as was being implied. Citing the rapid daily increase in new infections, Prime Minister asked for full cooperation from the public by taking care of themselves, strictly observing safety measures, and refraining from visiting high-risk locations. While admitting that he does not want to punish anyone who breaks the tough travel restrictions recently imposed in the 5 coastal provinces, like we talked about the Royal Gazette in the news yesterday, or those who conceal information from authorities, he said that the restrictions are necessary and must be strictly enforced for the common good. He reiterated that not downloading the MorChana tracing application onto smartphones is not an offense, but he urged members of the public to tell the truth when questioned by the officials about their travels to high-risk areas. Okay, so when we talk about MorChana app, I'm just going to close this window. And we're gonna come to MorChana app. MorChana app, I first known about this application last year in April. It was launched with the cooperation of many sectors, a lot of health experts, a lot of scientists, together with, I will name few of them, Electronic Transaction Development Agency or ETDA, with many experts in the various fields, including scientists and medical experts, Chulalongkorn University, Thammasat University, Mahidol University, Bangkok University, Digital Economy and Society Ministry, Public Health Ministry. Those are few of them. There's actually so many more agencies and group of people that have been doing this together. Now, we're talking about MorChana app. I'm just going to show you. I'm using iOS. So here is MorChana. Here you go. I already downloaded, so I could just gonna click open. Some of you will say, I don't know how to read Thai, so here is what I'm gonna show you. I already set up everything, but I make it in Thai because you actually can change it to English. This is after I did the assessment test, whether I am in any risk. My husband is foreigner. Somehow that make me have low risk. Anyway, now to change it to English, you go to setting. The lowest one said change language. And now you see English. Is it clear? Okay, there. The bottom one. And now it's changing to English. And if you want to do another assessment, you click setting, and the second one is the risk estimation questionnaire. I'm gonna do it again, and it said start evaluation. They will ask whether you have temperature 37.5 degrees Celsius or higher or not, whether you coughing, sore throat, tiredness, shortness of breath, vomit, or none of all both symptoms. I'm gonna say none of all both symptoms. Now, Did you go overseas in the past 14 days? That would be very difficult to do if you don't go through natural channel. I would say I did not go overseas. Next, did you get near a person who had COVID-19 risk in the past 14 days? Not that I know of, so I'm gonna say it. None of all both. Do you have an occupation that need to be close to a foreigner frequently? No, actually. Oh, now I have very low risk. It's going to be green. So they will have 4 color code. Green is very, very low risk. Yellow is low risk. Orange is moderate. And red is high risk. So this is the app that should be able to help you. It will ask to use your Bluetooth. It will ask to give you notification. It uses GPS, and it said that it will not infringe on your what's it called, private information, but it will give you notification if you happen to enter into the same area with high risk people or infected people. But it will not say who those are, but you will know when you enter the high risk area. And that's how this is the first time today is the first day I downloaded it. Dr. Tuisin said that in the past 24 hours, there's probably around like 2 million downloads already. So that's a good sign. A lot of people try to cooperate, being cooperative with the government. And that's it, you guys, for today. I hope this news is useful for you, and you can always get update with the COVID-19 news and other news in Thailand on Thai PBS World. We have Twitter, we have YouTube, we have Facebook, and we have our own website. And we will do 2 rounds of live updates like this a day. At 1 p.m., which is with me now. Next week will be with another anchor, Nat Bunnak. And at 7 p.m. will be me and Nat Bunnak doing a full show as well. We will try to give you the whole picture of what's going on in Thailand on this COVID-19 outbreak. And see you again at 7 p.m. สวัสดีค่ะ